from that point, if anyone has any questions, please fire away. Don't be afraid. Don't be shy. There's also a chat box that you could potentially ask questions via that option. But I would just recommend, in case I missed that, simply just voicing your question. It's far easier, especially in a smaller setting. There are other people besides the people pictured here. For those of you who have not met me in the past, my name is Chad de Bonaventura of Bay State Benefits. So what I'll be doing is walking through the new benefits for the organization. And I should note, anyone, I will mute everyone so that there's no background noise. So, thank you for your time. And again, we'll start the benefits presentation. So one of the things here is, this is the annual open enrollment. So with an annual open enrollment, you have the ability to enroll in a plan, waive the plan, or make changes. Normally, under non-COVID times, this can only be done with a qualifying event, meaning the birth of a child, etc., which I'll cover in a second. These benefits take place effective July 1st. We are going to ask that you go into the online enrollment system and complete enrollment. There'll be information at the end of the presentation, but I will just note that if you worked at Southern Worcester County, you've gone through the portal before. We do ask, so you've completed your life and disability information. That information will not show, because that is not part of the open enrollment, in case you're wondering where that information is. Employees will have until June 18th to complete enrollment. At that point, everything will be submitted to the insurance carriers. And again, it'll be done online via the Employee Navigator system, which you will receive an email link for. Now, normally, and again, I say under non-COVID situations, you can only make a change once per year. With that change would be during open enrollment, and then you would have the ability, if you had a qualifying event, to make a change. And that qualifying event could be marriage, birth of a child, divorce, etc., would all qualify you for the ability to make changes. Right now, due to COVID, the IRS and the government have agreed to allow participants to make mid-year changes. But normally, once everything settles down, again, it's a once per year open enrollment, and then you would need a qualifying event to change. So if you decline coverage now, but wanted at a later date, you would need to have one of these life events take place in order to obtain the coverage. One important item too is, within that life event, there are restrictions on time. So we do ask that within 30 days of the event that you do provide the information. Normally, we see this with the birth of a child. So if anyone is expecting or will be expecting or planning to expect, once the baby's born, there's about a 30-day window to notify the insurance carrier. So the benefits enrollment sees the two organizations come together. So this is the first open enrollment for the Care Central. And with that, there's some changes coming across for both the medical, dental, and then the addition of the vision plan. And what happened in regards to the changes was, we had done an RFP to look at multiple insurance carriers, multiple plans, and then to find the best solution for the overall organization. What we determined was the Harvard Pilgrim plans, based on plan design and price, offered the best solution for the overall organization. So we'll be offering 3 Harvard Pilgrim plans. One will be a traditional HMO, just like your Blue Cross plans. One will be a reduced network with a smaller number of providers, but still the HMO. And then the third will be a PPO platform that will allow you to see providers anywhere in the United States. There'll be a health reimbursement account for a portion of the deductible that I'll get into as we move along. The dental coverage will be changing from Blue Cross and/or Delta to Guardian, and then we'll be introducing a new voluntary benefit, which is an employee-paid vision benefit through one of the largest vision carriers in the United States. So just a little recap on the three plans. And this is more of just an education of terms because I deal with this every day, so I will sometimes use acronyms, and the acronyms are different based on the industries people work in. So the HMO plans from Harvard Pilgrim will require you to select a primary care. You, along with any of your dependents, must select a PCP, and PCB will be on file. The HMO plans will both require referrals to see specialists. They will not allow you to see providers not in the network. And for anyone traveling outside of the service area, you're only given emergency care. Now, the Best Buy HMO is Harvard Pilgrim's largest network in terms of an HMO. That covers essentially all of New England, with the exception of Vermont. And then the second HMO offered, called the Focus, is really a Massachusetts-based plan with a restricted number of hospitals and providers, and I'll show the hospitals in a few minutes. The PPO plan is really what people will call the Cadillac of insurance. It will require no PCP. It does not require referrals. It would also allow you to see providers that are not in the network, and that's typically what I find to be mental health providers or chiropractors. It is more expensive, but it has complete freedom with no primary gatekeeper. And where is it most effective? That's typically the most common question. It would be for those that have dependents going to school or living outside the service area. So if you were living in, say, Worcester, but your child is in California, then this is a viable solution to offer coverage, whereas the HMO would only provide your child with emergency care only. Now, this is just to show the area of the HMO network, and this is Harvard's large non-focused network, and this just shows you that it encompasses Maine, New Hampshire, Massachusetts, Rhode Island, Connecticut, and they do actually go anywhere from 10 to 15 miles into the additional states. So they actually push the border a little bit into Vermont and a little bit into New York. So most insurance carriers do that. They don't typically end on a state line. They typically push a little bit beyond the borders to capture those border states, those border employees. Now, I had talked about the Focus network. The Focus plan is going to be available to anyone. So any employees or your dependents will be able to enroll. If any of you are living on the South Shore toward the Cape, it will not be a fit for you. There are restrictions in terms of that network. It will also, standardly does not include UMass Memorial or Boston's Children's Hospital, but care can be given to those at those hospitals with authorized access approval. So you have to work with the insurance carrier to get approval to go to those, to obtain services at those hospitals, as they are not standardly part of the network. And that's key, is really looking at where are your providers and where are the hospitals and where do you plan on having services performed. And I'll show you a larger map shortly. Here it is, the map. And this is showing you the Focus network along with all of the hospitals. And one of the things, you know, the key hospitals we were looking at was St. V's, then Harrington, and then the old Hubbard. So you'll see Hayward, and but UMass is not part of this network unless you have that authorized care. So here's a listing, though. This is a complete listing of all the providers, and we'll show you how you can find that on the Harvard Pilgrim site shortly. But this just gives you a good overview. If your primary is affiliated with one of these hospitals, or if this is where you plan to obtain services, then the focus plan, which is the less expensive of the three, could be a very viable option for you. Now, I highlighted this for more of the PPO. So for any of you that are looking to enroll in the PPO plan and want to have that national access, do not want a gatekeeper, and do not want to worry about referrals, then within this service area, Harvard Pilgrim utilizes their HMO or PPO network. But if you start living or obtaining services outside of that service area, they use United Healthcare's network. So Harvard by itself does not have a national network. They have to work with an insurance carrier to take advantage of their network outside of the service area that they have. So basically they have these New England states, and then outside of that, the PPO utilizes the United network. Now, you will see here's the link. In this link, and I can have a copy of the presentation sent. Well, also, it shows you how to look up the providers. You simply hit the link. It says select the plan, and you can just pick the plan here to find your provider. So if you were thinking about going the Focus, you'd pull down the Focus. If you were thinking of going the Best Buy HMO, you would pull down the HMO or the HMO Access. Nationwide, United Healthcare they're the largest insurance carrier for group health insurance in the United States. So their network is vast, and the number of hospitals, et cetera. So employees or dependents outside of New England have access to a vast network of providers. Now, I wanted to give a little services overview before I start getting specific plan information. Within the platform, any preventative care, which is generally your physical, your OBGYN, pap smears, and for maternity-related expenses, there is no copay, and we'll highlight that, along with preventative immunizations, I can't speak today, screening such as blood sugar and cholesterol, which is part of your standard physical. Within that, there's 7 items that fall within the standard protocol of a physical where there's no additional charge. And then, as I noted, the prenatal and postpartum visits. So what will go toward a deductible, and what is the deductible? Similar to auto insurance or other areas where there's a deductible, it is the first dollar expenses that you'd be responsible for before the insurance begins. So typically lab work, x-rays, inpatient care, outpatient care are really the key items for what will transition toward your deductible. And this is a good lead-in to the actual plan. Now the plan, the HMO, Best Buy, and the Focus, the benefits are identically the same. The only exception is the Focus network is a smaller number of providers and hospitals. Benefit levels match, number of doctors and providers do not. With that, this plan will have a $2,000 individual deductible and $4,000 if you're a family. Now, no member of a family can contribute more than $2,000 toward that $4,000 deductible. For example, if I have a family plan and I have a dependent that is sick, the most he or she can reach toward their deductible is $2,000. So one member of the family cannot take the entire $4,000 deductible up. Now, there is no cost for the preventative care, so that was covered in full. I should also note that at this time, there's no cost for any COVID-related expenses. So any type of care related directly to COVID-19 is 100% paid for by the insurance as well. An office visit, to see your PCP will require $25, and to see a specialist would be $40. Now, if you go to either a primary or specialist and have lab work done, x-rays, etc., those items would go toward the deductible. So it's very important that you do note that I may go to my provider, I pay them the $25, but if I had lab work done, I would receive a bill in the mail eventually for that lab work. Typically, it's about 23 days minimum before you get a bill, unless your provider is very, very good in terms of the billing. For any care after the deductible, there will be additional copays. So any inpatient care, outpatient care, MRIs would require a $500 copay. And then the emergency room would require a $250 copay. I would urge you, in lieu of the ER, especially with today's times, to look at freestanding urgent care centers or the telehealth option that I'll cover shortly. I will note that urgent care has come a very long way. I mean, a couple of years ago, I broke my hand playing basketball. I set an appointment. I went to the urgent care. I received x-rays, a cast, and they booked my specialist appointment all from there, and I was in and out in 40 minutes. So it's very, very efficient and very affordable from the plan's perspective. In terms of the eye care, there would be a $25 copay for that service. And I should note, I will be covering the health reimbursement account of the deductible because the organization is paying a portion of the deductible, but I'll be covering that as soon as we finish with the PPO plan. Now, the PPO plan, for those looking for a more robust network and they do not want to deal with gatekeepers, meaning primaries or referrals, this is your option. This plan, though, allows you to see providers in the network or providers outside the network. If you do visit a provider outside of the network, the deductible will be higher, and you'll actually be responsible for that larger portion of the deductible, and something else happens after the deductible. What happens is, after you've gone out of network, the provider, since there's no contract, has the ability to charge you whatever they deem necessary. So nationally, about 5% of care is rendered out of network. So if you were to say, is my provider out of network? There's a high probability they aren't. They are not, especially in Massachusetts. But if you're on this plan, you should always ensure that the provider is in network along with the hospital or whatever area you're receiving care. Because there is no contract between that provider and the insurance carrier. So you're liable for anything that the insurance carrier does not pay for. So just note that. And again, it's a small majority of care percentage is rendered out of network, but I just want you to be aware that there's a negative to such a great plan, and that is the billing out of network. In terms of the copays and the plan structure, if you are going in network, it is going to mirror the HMO that we discussed. Same deductible, same copays, and same copayments after the deductible. The prescription drug plan on all three plans is very similar to what you would have now, except at GVNA it's 3 tiers, and I know at Southern Worcester County, it's 4 tiers at GVNA, and Southern Worcester County is 3. So with that, you have a 30-day supply, would be up to $15 for generic. So if you are taking a generic drug, it is up to $15. If the drug is $7, $8, $9, that's what you're gonna pay. For a tier 2, which is a preferred drug, that would be up to $30. And then the non-preferred and specialty drugs would have a $50 copay. If you want to receive a 90-day supply, you'll see that it's double the copays for tier 1 and tier 2, and then it's triple for tier 3. There's little to no savings there, unfortunately, on the mail order. The mail order used to create substantial savings in the past. For anyone that is taking prescription drugs currently, we are gonna, it's gonna be required that you have a new prescription issued, so you'll have to call your provider. And the pharmacy is going to want a copy of your new insurance card, and we'll cover both shortly. If you're going to be using the mail order portion, it's going to go through Optum Rx. So Blue Cross uses Express Scripts, Harvard Pilgrim uses Optum Rx. You'll be able to set everything up for the 90-day supply, to have the mail order set up. But similar to Blue Cross at this time, due to the COVID-related COVID-19, they are actually allowing you to get excess prescriptions. So you can get an excess of 30 days if you go to the pharmacy at this time, as the insurance carriers do not want to force you to go to the pharmacy as minimal as possible due to the pandemic. So anyone currently taking a prescription who would normally refill it at the beginning of the month or the end of the month, I would just make sure, I think it is always good to refill prior to an insurance changeover, because going to a new plan could require prior authorization where your drug just needs approval, and I'll get to that portion in a second. And there's always just the insurance carrier and the pharmacy ensuring they're on the same page. So if you have the ability to get the prescription at the end of the month or prior to the first, I think it will be very helpful, and it would ensure no issues on July 1st for you. The Optum network, it's going to allow you to see any of the pharmacies you were going to before, the CVS's, the Rite Aids, Walgreens, Walmart, etc. And you can go online to Harvard Pilgrim's website and just type in pharmacy and go to 3-tier. And from that point, you'll be able to search to see exactly where your drug fits in terms of coverage levels. Now, Blue Cross, Harvard, Tufts, insurance carriers all have a different formulary where the drugs will fall. So a drug may have been a tier 3 with one carrier. It could be a tier 2 with another. It may not be covered with one, as they cover other alternatives. So this is one aspect that we can never say is an exact match to what you've had previously. And I will provide a number coming up for anyone that has questions on the pharmacy, where they can simply call Harvard through their Smart Start program and really just check to ensure exactly what is needed for that drug approval. Now, the health reimbursement account. So the HRA, as it is known, is something that is going to reimburse a portion of the deductible. So the organization is saying, we understand that you have a deductible of $2,000 for an individual and $4,000 for a family. We're going to make you responsible for the first $500 if you're an individual, and $1,000 if you're not an individual. Meaning, for someone that has a employee plus one plan or a family plan, we're just going to ask that you, sorry, I'm just muting that one person. We're going to you will be responsible for the first 500 or the first 1,000. So 500 individual, 1,000 for a family. The HRA will then pay the next 1,500 per individual or $3,000 worth of expenses. So here's an example, and I'll explain how they pay it. If I incurred a bill for $1,800 and I'm a single, I will be responsible for paying the first 500, and then the next 1,300 is automatically going to be paid on my behalf by us at Bay State Benefit Services. So we actually obtain the information from the insurance carrier, and we pay your providers directly on your behalf. So you can just register an account at our website, and by doing that, you can see what was paid, for what bill, and how it was paid, and when it was paid. It's a very seamless process. We do ask that you always just track where you are in regards to the deductible. And secondly, I think it's very important that you understand what has been paid and what hasn't been paid. The key is, I think the easiest way is, once you know that you've paid that $500, that you simply, or $1,000, you simply wait until the second bill. If you ever get a second bill and you think something should have been paid via the HRA, please reach out to us. We're typically paying the bills within 7 to 9 days of receipt. So we typically receive the information on a Monday from Harvard Pilgrim, and our goal is to have every provider paid by Thursday. Snail mail, so they get a check and they have to cash the check and deposit it. So automatically reimbursed on your behalf, the providers are paid. So the deductible, even though it's $2,000 if you're an individual or $4,000 if you're a family, to you, it really should look as and feel as though it's a $500 individual deductible and a $1,000 family deductible. Thank you to the HRA. You would be responsible for the co-payments after the deductible. Now, once you receive a Harvard Pilgrim ID card, I do think it's a smart item, and same with Blue Cross Now. You can log into their website and register as an employee. By registering and securing an account, you'll always be able to see your claims history, explanation of benefits, and you'll be able to find providers. So I think it's a great site. There's just a lot of information there. There's also tools to look at cost, transparency, pricing, just a lot of access there. Sorry, let me just see why. Now, you will also be able to obtain a digital ID card. This digital ID card will allow you to add your medical card to your Apple Wallet. And I spoke earlier, I do think that this is the future. I think at some point the insurance carriers will stop issuing cards. So I think it's something to just, think about. If you have dependents over the age of 18, you won't be able to pull their cards. You won't be able to pull your spouse's card. But this is a great platform. It will allow you to download the card and ensure that it is on your phone. I do have a question here. If you currently have a Bay State account, do we need to create a new one? No, you would not need to create a new account. So this technology will also allow you to see more information such as claims, providers, etc. But for me, the key thing is viewing the card and attaching it to your wallet so it is there and you're not carrying it in your pocketbook or in your wallet, it's in your phone. But they will issue cards at this time. Now, Blue Cross uses American Health for their telehealth, and Harvard Pilgrim uses Doctor on Demand. Doctor on Demand is a portal that allows members the ability, so you will go to the doc, I call it DOD, the Doc on Demand site, and register. It will allow you the ability to FaceTime 24/7 with a physician. The physician can issue prescriptions. It can, it's typically done for the more simple items, pink eye. People will do it for strep throat, sinus infections, etc. And a newer aspect is behavioral health. So the options are really expanding, and they are allowing you the ability to see a behavioral health specialist, regularly schedule appointments, and meet with that same provider. These will require an office visit copay. If they are COVID-related expenses, there would be no copayment at this time. But for anything non-COVID related, there will be an office visit copay. But I think this is really where the future is going. Due to the COVID virus, this has increased 1,000-fold. The utilization is significantly higher. And there's real questions as to if people will continue to use it in the volume they are, or if they will go back to a more traditional way. But I do think it provides a great service for you. It helps the overall expenses on the healthcare plan. And it's very, very efficient when you can simply just go from your iPad or your phone and FaceTime a physician. Now, I talked about the transition of care, really on the pharmacy side, but there's both the pharmacy and then the medical care side. So for someone that has a procedure scheduled or something coming up in the month of July or thereafter, there is a number here, 866-874-0817, that will allow you to speak with a Harvard Care specialist. That specialist is a transition of care. They will be able to assist you with ensuring that you have approvals, exactly where your prescription falls, what is needed to ensure that prescription is approved, and are your providers in network? They're going to walk you through everything if you have questions. So I want to know, should I get a prior, I had a prior authorization for my prescription with Blue Cross. Do I need one with Harvard? You could simply call and they'll be able to walk you through that. We are in the process of finalizing setup. I do expect this to be up by the end of the week. Now, it's very valuable for those with surgeries. So if you have a surgery or some type of scan coming up after the 1st of July, I would recommend starting the transition of care just to ensure that there are no issues and that everything can smoothly transition to Harvard on your behalf. And we are here to assist you as well. So you could contact anyone within HR and they can put you in touch with us, and we will also help you with that. Now, the Harvard Pilgrim platform will also offer additional benefits. So they're going to give you the ability to obtain $150 worth of, I'll call it fitness reimbursements or gym reimbursements, even though no gyms are open. If you're paying, you're still eligible for the reimbursement. And I would like to remind you that if you are insured through Blue Cross and have not done that yet, you are still eligible. So you should still put in for your gym reimbursement and get that money. So you could actually double dip, get Blue Cross and then get Harvard. So take advantage of that. And Harvard will be giving you up to $150. If you choose not to enroll in the I plan, they will actually allow you to get a discount. It's only a discount on glasses and lenses at certain providers, and it is simply a discount. They're also, one of the newer caveats to the plan across the board is they will be adding acupuncture. And they'll also be providing you with the ability to obtain like massage therapy, Tai Chi, yoga chiropractic items, really alternative medicine at a discount. So you can go to the site. It's a very small network of providers, but there is a discount available. And then they'll provide additional discounts. We'll be emailing out a kit shortly. That kit will contain a lot of information regarding that. The one that I like the most, because with Harvard, is the Marathon Sports, because I think they gave a great discount on shoes if any of you buy your shoes through Marathon. An overview of the fitness benefit: it's one per family, $150 per calendar year. You have to be on the plan for at least 4 months, and it would have to be a qualified fitness facility in order to receive it. Fitness facilities that offer yoga, Pilates, and other items are all eligible, but a yoga studio by itself would not be eligible. I'll just stop here. I see I have a question. So one of the questions is, do you know if do you know if behavioral health is covered? It would be behavioral health. So that is one of the mandated benefits. So with any insurance, it's actually, there's a Mental Health Parity Act. It is covered. There are restrictions in terms of the limitations. There are authorizations, but it would be the same as Blue Cross. If you are going to certain providers, I would look to the not enrolling in the Focus, but go to the traditional Best Buy HMO or the PPO plan. But there will be some approvals needed if you are, depending on the level of care. But yes, behavioral health is covered, and it will be covered in the same manner as it was with Blue Cross, and that is due to the Mental Health Parity Act. Before I move on to the dental, does anyone else have any questions? If you do, you can just simply type into the chat box, or you can simply unmute yourself and feel free to ask away. Okay. Now, one of the, an additional change would be the dental. So whether you had the Delta plan with SWC or the Blue Cross plan with GVNA, the platform will now go through Guardian. Guardian is actually one of the largest providers in the country. They're the third largest dental provider. They are now affiliated with a number of the state plans, and a new plan rolled out that's rolling out by the Mass Biotech Council. They're becoming a large dental provider within the state. And they do have a partnership with Harvard that allows for preferred benefits, and is really an exceptional program. So similar to any dental carrier, they're going to allow you access to all providers. But with that, about 65% of the providers in the state are in their network. If you're going to one of those providers, the average discount is in excess of 25% nationally. I was on a call yesterday. They're saying that in Massachusetts is as high as 36%. And then they offer a higher level of coverage thereafter. So if you go to a provider in the network, the insurance is going to be paying a higher percentage on a lower amount, meaning you're going to have less out of pocket. They also will carry that discount for the life of the year. So when I say that, each member is given a $1,000 calendar year maximum. So myself, my 3 kids, my wife, we each get $1,000. Now, if I incurred $5,000 worth of expenses and I see an in-network provider, I'm going to get that discount on the full $5,000 worth of work. Even though $1,000 is only covered by the insurance agency, because I'm going in-network, I'm getting a discount on the entire amount of the insurance that's billed. So that's significant if you're getting a large volume covered, in terms of if you're getting a lot of work. For those that go out of network, you still have great coverage. What does happen is the insurance carrier essentially says, we're going to pay 100% of what's called a reasonable and customary amount, what 9 out of 10 dentists in that area would pay. Meaning the reimbursement will be slightly lower. There will be a out-of-network deductible for type 2 and type 3 services only. So you would still have no cost for your preventative care. And then for the orthodontia, this will give you a lifetime benefit for any children under the age of 19 of up to $1,000. We are hitting an issue is the ID cards, and this is a national item. Insurance carriers are not wanting to issue ID cards due to the COVID virus. So at a later date, we will have them manufactured and sent to your house. But in the interim, we're going to have a digital ID card that you'll be able to access and use to insure. So they use a generic card. It doesn't have your member ID on the card, but this will just ensure that you have no issues. But this has been one of those things where the manufacturing sites for several of the insurance carriers have been shut down, and they're just starting to get reactivated now in terms of the printing companies. The new plan being offered is through IMED. So IMED is the largest vision carrier in the United States. They're owned by a company called Luxottica. They have a vast majority of the eye chains. So the LensCrafters, the Pearl Visions, the Target, Sears Opticals, and then they have your private practitioners. They'll also give you the ability to purchase your contacts through a provider or online at Contacts Direct, and glasses at glasses.com. If you choose to go out of network to someone not in their network, there will be a reimbursement, but it will be at a set amount, and you'll have to pay up front, and they get paid on the back end, and I'll walk through that one second. So how the plan will work is in-network would be providers contracted with IMED. So you're going to be able to get a yearly eye exam for $10. So what most people do is they'll use their medical exam for one and then this for contacts or vice versa. You can then get lenses for as low as $25, depending on what you're having done to your lenses. A good example is I used to have my lenses shrunk down before I had LASIK surgery. And I would actually get a frame within my $130 allowance, because they give you an allowance on a heavily discounted frame, and then they give you a percentage off after the allowance. But I would simply, there's about 5,000 frames that are within the allowance. I would take a frame where I had no additional cost, and then it would cost me about $60 to have my lenses done because of the cost to shrink them down because of how blind I was. Now, you will also be given a contact allowance, and each of these is annual, along with a discount for LASIK surgery. One thing is you cannot get new contacts and lenses in the same year, so that's one caveat to a vision plan. So you can get your exam every year. What most people do is 1 year they'll get the lenses and the frames, and then the next year they'll just get the contacts, or vice versa. I mean, it really depends on how you want to structure it. If you go out of network, you will be paying, and then you simply have to submit a claim form for reimbursement. So you just submit the claim, and within about 30 days, you'll receive a check for up to $50 for an exam and $74 for frames. So something is better than nothing in that aspect, but I do think it really behooves you to look at going in network or to glasses.com or Contacts Direct, because it's going to save you substantially. This is one of the benefits, that glasses are just so expensive that you really have the ability to take advantage of the plan and save substantially. For those wondering, I do have a lot of employers and employees that go online. So they'll go even beyond glasses.com. They'll use Warby Parker or Zini Optical. That is actually out of network, but those are still great products at a reduced cost. So it's one of the things that the traditional of just going to your eye doctor, getting the glasses, is really changing, because there's a number of different avenues now to obtain a far lower cost on your prescriptions. Now, you will receive an ID card. You'll also be able to use the iMed app. So you can just download it once you get your card and register, or you'll be able to go to imed.com. I would recommend just going there, and you can find a provider. It's very easy. You can download the forms. It really is an easy site. It's a great product, and it's one for me that has saved substantially. I used it to get the 15% LASIK discount, which was very significant for me. Now, here are the deductions, and this is for the full-time employees at 40 hours, or those at the Healthy Families and Adult Day at 37.5. Okay. You'll see the Best Buy HMO, the pricing, and the focus. So you'll see the differential in pricing. You'll also see the PPO costs. So the PPO is the most expensive of the
dental plan, $8.11.
Is that a good or a bad? I think it's good, but and then the cost for the vision. So and these again are per paycheck and based on the tier. Now, for those part-time employees working 30 to 39, you'll see the different contribution on the medical, but then the dental and the vision costs would remain the same. Now, really the final item is, so historically the FSA has, and flexible spending account and dependent care has been run on a calendar year. So the 1st of January to December 31st, but due to the COVID, you are now allowed to make changes. So if you're already enrolled, you can change your election. If you're not enrolled, you can decrease your election, or you can add your election, or you can decrease it, or you can simply waive. Just remember that it's 13 weeks, as it's going to be July 1st through the end of the year, so it's not a full plan year. You can still elect up to the $2,750, but the COVID has allowed for these changes. The FSA is great because it's giving you the ability to use pre-tax dollars to pay for qualified medical, dental, and vision expenses. And you're just saving on the taxes. You're lowering your taxable income and you're purchasing items you would have purchased anyway, but now you're using pre-tax dollars. You will have the ability to roll over $550 into the new year. So if you're on the fence, you could elect $550 and that will roll over. Every employee who is enrolled along with dependents will receive what we call a benefit card. It's a blue Benny card that you can use. You could also set up direct deposit if you want to submit your claims paper or electronically via the app. A lot of people would just take pictures and upload it to the app, or simply just use the Benny card. I think the Benny card is the easiest. I did want to note that for anyone that goes out on leave during the year, the account actually goes on hold until you come back as an actively at work employee. And again, I noted what people use it for, but what do I most commonly see it used for? The deductible, the co-payments, dental care, glasses, contacts, and prescription drugs. If you're taking a prescription drug every month, you're paying post-tax dollars to buy that script. You could utilize the platform and fully take advantage of that. Co-payments, contacts, all FSA eligible. And now over-the-counter items are actually eligible through the end of the year, thanks to the legislation in regards to the COVID. I do see a question. On hold. What about, so one of the questions is about it being on hold. What about on the money on the card before you went out on, so if I was to go on leave, what happens on the money? So with that, you would have 90 days, you have a time period to submit for expenses that went out prior to that. And there's the potential when you come back to have the plan reactivated, or if you never came back, there's the potential that you could lose it. So there's that negative if you just never came back. Hopefully that's not the case. Yep.
Chad, I'm sorry, I unmuted myself. I just want to make sure that I'm clear on this because this is something different. So if I had $1,000 in my FSA and God forbid something happened to me and I went out on a leave, a medical leave, I could not use that $1,000 that was in.
So you can use it. You have 90 days to submit before you went to the date whenever the leave started. But once an employer stops taking deductions, then you're no longer active in the FSA.
That makes more sense. Yep. Thank you. I just wanted to, didn't make sense. Thank you, Chad.
Yep. Another question was, do you have a list of the OTCs covered under this? I do. It's a partial list because but I will send it over so it can be distributed. The other aspect is the dependent care. So the dependent care allows for children under the age of 13 to be covered for daycare, summer day camps, preschool, after school, by a qualified, like essentially an employer, I mean, or someone with a tax ID. If I'm having my relative watch my child and I'm paying them cash, I cannot submit for the dependent care. You can elect up to $5,000 annually. With it, the money is a little different. The FSA money is available upon the first day of the plan. So if you started it as of July 1st, you get that full amount in there. The dependent care, the money has to come out of your paycheck and into the account before you can spend it. And it's a benefit that right now we're not seeing people enrolling. With what's going on with the crazy time where are they going to have summer camps? What is going on with school? What is going on with preschool and after school? We're not seeing people enroll. But it is available to you for those under 13, and it's a pre-tax benefit. Now, you should ask your accountant on this benefit if it makes sense, because there's two thoughts. Is this more beneficial than the tax credit I get? That your accountant could answer. But generally, if you make over 41,000, people say that the full $5,000 dependent care is more advantageous versus the tax credit. But I would just ask your accountant if it would make sense for you financially. Now, Employee Navigator. So you're going to receive an email link. And the email link is going to require you to log in. So it's an enrollment system that will allow you the ability to just click, 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 go through the enrollment, pick your plans, and then summarize your plans and finalize enrollment. With it, you'll go to the Employee Navigator site. You'll register as a new user. You'll have to create an account, a username, and a password. Any of the Southern Worcester County employees that have logged in before, you would be a returning user. So you could simply just log in. And that aspect is very easy. From that point, you would actually just start picking your benefits. So it's going to ask you to start enrollment, and you will have to start enrollment even if you are waiving coverage. So you decide that you don't want coverage, we're asking you to just waive the insurance. You will walk through it. You will have to include you'll have to confirm your information. You'll have to add your dependents. So you'll have to add your dependents' names, dates of birth, and socials. So that information would need to be captured. We want to make sure everything's accurate, precise. And for those taking an HMO, you will be required to include the primary care information, meaning the primary care name. Upon that, you will then be able to walk through, the first would be the medical. It would then go to the dental, the vision, the flexible spending account, and the dependent care. And then you'd simply be able to complete it, enrollment, and print an overview summary, and you'll be done. I mean, the actual enrollment is very quick. It's generally very easy to use, but if you don't want a benefit, down on the bottom, there's something that says, I don't want this benefit. That would be the manner in which you would waive the plan so that you are not enrolled. After you've completed it, you can always go back in and make changes if you want. So it is not frozen in time or cement. You can go in, make a change, and move forward after that. With that, I will ask, does anyone have any questions? I covered a lot. There was 36 slides of information, so there's no doubt I was rambling. So anyone have any questions, any thoughts on any of the items? You can either unmute yourself or simply just ask me via the chat panel. And there's going to be other meetings, so if you want to come in and sit in again, you're more than welcome. I know it's a lively topic, but you can ask away at that point if you had any questions. But I'm here, so please fire away. No questions? I'll thank you for your time. I'm going to stick around, so if anyone has any questions.
I have a question.
Oh, yeah.
I'm sorry. I'm on the Employee Navigator now, and I'm not seeing the option for PPO. Am I in?
I would have to look at it. It should be HMO.
It says it's asking which plan do I want. It says focus tiered copay plan, Best Buy tiered copay plan.
It should then have a PPO plan option.
No, it's not there.
What is your name?
Oh, I'm sorry. Sheree Jeffries.
Sheree. Okay, let me just look on that, and then I'll confirm because I can't access it right now because I'm in this.
Okay. Thank you.
You're welcome. Any other questions? Well, I'll stick around. So if anyone has any questions, please stick around and fire away at me. But I really do appreciate your time today. Thank you.